Good morning, good afternoon, everybody. We are a small group right now, which is actually quite nice for a clinic. My name is Zara Rizvi. I'm going to be facilitating and moderating us through Clinic 4, which is called Preparing Our Social Protection Sector for Future Shocks in Times of COVID-19 and Beyond. And it's very much around working alongside the humanitarian sector. I'm going to go ahead. So I'm Zara. I work for UNICEF in the Middle East and North Africa regional office. But this event is hosted by the Grand Bargain subgroup on linking social protection and humanitarian cash transfers. I used to work for them, so this is why they've asked me to, I'm double hatting right now, so this is why they've asked me to come in and facilitate this session. It is also hosted by Transform, and I will open up the mic and let Valentina explain what is Transform, and SPACE, which is Social Protection Approaches to COVID, which is FCDO and German Development Corporation. So FCDO, formerly known as DFID, German Development Corporation, not corporation, sorry. Is it German Development Ballet? I'm looking at you. Yes, but that organization. So that is who SPACE is. And then we also have the online community for social protection in crisis, which is part of sp.org. We are a small group right now. This clinic is being run in 2 different sessions. We have made sure that we can that everybody has the possibility to unmute themselves. Some people are shy, but we would love it if you are able to open up your cameras. If you can do that so that none of us are talking into a void and we can actually have a conversation. I think it's great that even though we had like 100 some people register for the event, that we're actually quite a small group. So that works out quite well. I'm gonna go ahead and introduce very, very quickly Valentina and Gabrielle Smith, who are here from SPACE as our resident experts, but really the experts is all of you. And again, we want to be able to do this as a conversation. So Vale, if you want to explain what is Transform and then say who you are, please.
Yes, so for Transform, actually, I'd like to hand over to Maria Laura, who I see is online,
Yes.
who is Transform coordinator. If Maria Laura, you want to very quickly.
Hello, hi, good morning. Hi everyone, apologies for joining a bit late. Greetings from Lusaka. Hi, Zara and Valentina, Gabrielle and colleagues. I see that Daniel Kumit is also online as a representative of our community. So Transform in a nutshell is a learning package which tries to apply an innovative approach to learning by, rather than teaching people about social protection, particularly non-contributory social protection, trying to enthuse them and make learning in the region, particularly Southern and Eastern Africa, that there was a significant implementation gap in social protection. A lot of policies, a lot of frameworks, a lot of great Western or global North approaches that really struggle to get off their feet. The learning package was born out of the need of filling that implementation gap by really focusing on the strength and expertise of Africa-based experts and African experts. The curriculum has been built by people based in this region and or from this region almost exclusively. It's coordinated by a body of now over 40 master trainers who are all social protection experts from the region who actually deliver the training. And most importantly, at least in my opinion, I don't know if Valentina would agree, is the fact that there is an experiential approach to the training. So the activities and the tools that we utilize are crafted in a way that people are not just there to listen, but they're there to get their mind shifted about social protection and to actually commit to change and be agents of change in their own environment. And yeah, I think I'll stop here. Thank you.
Fantastic.
Thank you. Thank you so much, Maria Laura.
And the reason why
Go ahead,
Transform is co-hosting here is also because we've recently completed kind of the process for a new module on shock responsive social protection. We'll be sharing the links to that, and then we'll be building on some of the insights that are coming from that. And I also represent the social protection approaches to COVID-19 team. We've been working supporting 30 plus countries over the past 6 months in their COVID-19 responses, and really trying to kind of get the humanitarian and social protection sectors to be working together. So happy to be here. Thank you.
Gabby?
Hi everyone. Sorry, I was on mute. Hi, I'm a freelance consultant. I'm part of the space team with Vale. I've been working on shock responsive social protection a fair amount for the last 7 or so years. So working on research, feasibility studies, options analysis, policy frameworks, this sort of thing. So very excited to be part of this team. Thank you.
Brilliant. Thank you. And since we've had quite a few new people join now for this session, which is great, I just want to reiterate at the start that, you know, we want to open it. Yes, we have Vale and we have Gabby, but it's very much a peer-to-peer learning event. One of the things that we discussed 10 minutes ago that we would like to be able to do is, you know, one of the things we always say is that we don't hear enough from our government counterparts, especially if they are governments that are working in contexts that are in crisis. It could be from a natural disaster, it could be from a pandemic, it could be from, you know, conflict, but whatever, you know, however we would term crisis. So we would like to make sure that the floor is open. Everybody can unmute. We absolutely want this to be as participatory as possible. Everybody here is an expert. You know, we also want to make sure people from the global south, which is an awful term, but, you know, these are the voices that we absolutely want to be hearing from first and foremost. So I would invite everybody, if you are able to turn on your webcam, please do so, but also let's use that chat box function as much as possible, and please unmute yourselves and talk and engage with us so that we are able to, you know, learn from each other as much as possible. I am going to go ahead, and I see nobody writing into the chat box, but if you can please go ahead and introduce yourself, say where you're from, what you work in, which country, you know, I think it would just make it much easier. And again, if you have the facility to turn on your webcam, please turn it on, keep it on, and engage with us. We will quickly go, because we've got 2 minutes. We wanted to give 10 minutes in the beginning for the introductory sort of phase. I am going to share my screen, but also for people to have that Slido link, I put it in the chat box. So if you can go to that, and let me check out how well I'm actually able to share this screen. Here we go. And this is our Slido. And these are the kinds of questions that we have received so far. We're happy to take other questions that people may have. And again, we do want to open it up for everybody to be able to participate. So you can either upvote a question, unmute yourself and ask another question. The grouping that we are seeing, I love it. People are in fact upvoting some of the questions, which is great. You know, looking at the questions before the session, we sort of started grouping them, and, you know, there's big questions around coordination between the humanitarian and social protection sectors. There is quite a bit around, you know, what are the, sorry, I just lost my train of thought, which is not great for a facilitator to have to do. So coordination is one of the questions, and then we have, you know, what are the essential actions? And I can see that that is the most voted question that we have. And sorry, maybe I should have been moving this as well. This question from Daniel, also quite interesting in terms of the alignment of humanitarian and social protection approaches. Is fragmentation by design more powerful than we think? So I'm just going to quickly look at, it looks like we'll just take the top 3 questions to begin with and open up the floor for everybody to be able to give us some practical examples if they have them, or challenges around them if they have them. But essential actions, and do we know enough about when not to use social protection systems and programs for certain shocks, for instance, in conflicts? What do we need to do to understand this decision-making process better? That also sort of kind of links to a question that's all the way on the bottom that humanitarian actors always like to ask in terms of neutrality, impartiality, working with the government. What does that look like? So I think we can address both of those within this. And then the coordination question. So we can go with essential actions on preparedness. We can go with when not to use systems for certain shocks, etc. And then we can go around coordination, and we can start with that. And I have 0 issues with an awkward silence. So I am going to wait to see if anybody else thank you, Zaina, for introducing yourself. If you have the possibility to turn on your camera, that would be amazing. But if we have, and I can see, Larissa, I'm sorry, I'm going to call on the people that I already know. But I see Larissa Pelham, who is the Global Advisor for Social Protection for Oxfam here. Hi, Larissa, nice to have you here. I see Catherine Teish as well from World Vision. And I think, Catherine, you are the Director for Cash for World Vision. I'm not entirely sure. Your title has changed a bit around the years. I see my colleague from UNICEF, Taylor. And Taylor, if you can also be, who has actually, I think, worked with Transform. Lisa Hannigan, you are from DFAT, I think, Australian Aid, and a big supporter of the whole entire shock responsive social protection agenda. And if anybody else has the opportunity, Sigrid from ECHO, nice to have you here as well. And then if anybody else would like to introduce themselves, and if, I'm going to be quiet, we are going to have an awkward pause, and that is okay. But if people can unmute themselves and perhaps start us off on the question of what are the kinds of essential actions that you have seen in your experience to be able to, that have worked or that you think are necessary in order for a social protection system to, in, areas where we have conflict or we have crisis, etc. There's a lot of recurrent shocks, etc. that do happen as well, covariate risks that we have as well. What are the essential actions that we need to put into place for a social protection system to be shock responsive? And Nyenke Gopin from UNICEF Afghanistan, nice to meet you as well. Argavan, also very nice to meet you, economist of UNDP in Iran, excellent. Benjamin, British Embassy, Nepal, very nice, hello.
Sarah, would you like us to start offering some thoughts, or do you want to spend a few more minutes on the Slido prioritizing and adding questions? I see a few more have been added. The problem with the ones added later is that they don't necessarily get upvoted fast enough.
Yeah.
But everything will be answered within the discussion forum. So even if it's not debated live, the written discussion forum is where we'll be going into more depth.
Yeah, well, I've got Larissa who has volunteered. Thank you, Larissa, so much. So please go ahead and start us off, Larissa, with to frame an initial comment.
Just a very quick comment. I'm going to be a bit quiet because otherwise I'll wake the kids. Yeah, just one thing that I often find when we start these conversations is I think there are 2 different things that we're looking at. One is how, as you said, Zara, we make, oh, hello everybody as well, sorry. One is how we make the government system be able to respond to shocks. That's one part of it, i.e. have a shock responsive social protection system, as you said. But the other part is how we make the humanitarian system integrate to support that process. And I just think those two parts, it's not a very profound comment, but I do think those two parts need to be looked at separately. Because I think we often conflate them, and then we're talking about shock responsive social protection and generally, but we're not being specific about, actors that are coming from the humanitarian sector and what their role is in supporting working with social protection. And that does not necessarily mean that they're even necessarily directly supporting the government system. It might be that they're able to utilize or work with the government system to improve their humanitarian response, which of course is what the overall objective is from the humanitarian side. But I think it's quite important to separate out the two sides between scaling up a government social protection system, but how the humanitarian sector can integrate or utilize or support social protection in order to deliver their humanitarian response faster. And I think those two things are just slightly different, and they shouldn't be conflated in a discussion. Thank you.
Absolutely. I'm going to jump on that. No. So thank you, Larissa. I absolutely agree. And on kind of when we're thinking about the first aspect, so the strengthening of the government systems, that's really where, for example, the new Transform module on shock responsive social protection focuses. And we're looking at, again, even here you have another bifurcation, because it's not just about the preparing to be able to respond to future shocks. It's also about your routine systems being better able to preempt and sort of respond to those shocks that are actually quite predictable, recurrent in country. So there's a lot of things that we can be doing and we can be thinking of within our country to be just kind of taking into account those shocks that we are facing within our country, those different shocks that are often multiple and overlapping. And of course, COVID has been a once in a lifetime type of scenario, but there are a lot of covariate shocks that just compound on top of life cycle risks that we could be thinking about cohesively when we're preparing our social protection system. And we can be doing that by kind of embedding at different levels. So embedding in legislation, making sure that kind of we're coordinating with the right people in this process. We can be thinking about targeting more holistically, not just looking at sort of the core poverty criteria. That there's a lot that can be done at a lot of different levels, and both in terms of routine programs and kind of sort of making sure, for example, that we're covering those kind of different types of vulnerabilities, but also in terms of then that preparing for what if we might need an expansion, we might need to be covering much higher needs, and that this type of scenario that we found with COVID. And that's from the government perspective, the strengthening of government systems. And of course, even within that process, you can have humanitarian actors supporting that, because there's a lot of knowledge that lies on one side or the other that can be leveraged. And kind of that's something that we've been working on a lot also within the space team recently, kind of where is it that knowledge can be leveraged? And maybe I'll hand over to Gabby for some comments on that.
Yeah, I mean, I agree with everything that's been said, especially with Larissa's comment. I think that the key, even though there's these two sort of twin tracks to the whole story, they need to be brought together, and they need to be brought together in a sort of strategic and cohesive way. So having that sort of broad stakeholder engagement from the beginning, I think that's really important, bringing everyone to the table, assessing and analysing, the options that you have. What are the entry points? Looking through, the different, what I always call like the building blocks of a social protection system. So looking at, your policy level, your legislative entry points, looking at your programmatic entry points, as well as looking at the gaps and the constraints and, the things that need to be improved or built upon, looking at your system entry points, and yeah, really when I say being strategic, I mean things shouldn't be sort of mandate or agency driven, as international partners working with a government, whether you're on the developmental side or whether you're on the humanitarian side, the roadmap, the strategy that gets put together, the preparedness plan, whatever you want to call it, it needs to be, it needs to be made with the options that are that make best sense for the country and the context, rather than being driven by perhaps a particular organisational area of expertise or previous programmatic expertise. And that is certainly something which I think is improving over time. And then really just develop, I would say, a realistic roadmap. From what I've seen in country after country, this thing, it takes time, it takes longer than we're anticipating. And as Vale was saying, it's not just about looking at the, immediately the shock response capabilities. It's about getting your basic system right. And one of the things we're seeing in country after country is the need to build coverage. If you have a social protection system that has good coverage, that is robust, that is well designed in normal times, that gives you a very good foundation to start, building something which has these broader capabilities. And that's obviously something that's more a sort of a developmental rather than a humanitarian area of programming. But we are still seeing that humanitarian actors have a role to play in supporting that, perhaps in places like where there's protracted crises, etc., where humanitarian actors have a broader remit. So Lebanon is a good example of that, where World Food Programme has been supporting the, increasing the coverage and actually the system strengthening of the National Cash Transfer Programme there, the National Voucher Programme there. Over.
Thanks, Gabby. Does anybody else want to come in? And thank you, Daniel and Zaina, for turning on your cameras, and welcome Pina Rocha from Malawi, working with Irish Aid, and Zamira from Tajikistan, Child Protection, UNICEF. But does anybody else want to add to what Larissa, Vale, and Gabby have said about, get your basic system right, because coverage can be an issue. Really looking at this from the government perspective and what is that roadmap, instead of looking at what your agency mandates are, etc. And I could see one question showing up on the Slido in terms of, how can we incentivize UN agencies to collaborate and work better around this? And Lebanon, a very good example, actually, Gabby, in terms of, I don't know if there was incentives around this, but COVID has been an incredible incentive. Before the Beirut blast and the, again, resignation of a government in Lebanon, what happened there is, and I know this because I now work for UNICEF, but the government basically, after COVID, requested that their whole entire process around social protection systems be looked at again, and they were making some really, really, really quick progress around, getting things into place. They did a lot of different consultations with a lot of different partners. UNICEF was organizing along with ILO and other UN agencies and other civil society actors, etc., to be able to, get something going, to have a social protection strategy, and for it to be shock responsive, and, looking at their massive cash program that they have, their flagship program, and how to get that up and running. And then the Beirut blast and the resignation of the government sort of stopped that process, or has interrupted that process, we hope, just for a little bit, and then we will see where it goes. But just to see, sorry, I'm going to look at if we have any unmuted mics that we would want to, if anybody would like to come in, either with examples or to add in terms of, what key essential actions you yourself have seen that are quite important, in addition to what we've heard. No? There was a question around social accountability as well that came up on the Slido. And, Gabby has mentioned one of the things, which is coverage, is something that, if your basic system is in place around coverage, it makes it that much easier to respond in a shock. And social accountability, and I'm saying this from my own previous experience working with the government or inside government, that this was one of the areas that we as government, British Virgin Islands, we were quite weak on that one, and we had to look at our civil society partners in order to make sure that our social accountability systems were much better. With the trust deficit across the world that we have in governments right now, However, to respond to something that is as big as the socioeconomic shocks of COVID, you need a government to be able to do that. So where does the social accountability angle fit into this? And I would love to hear from the different experts that we have in the room right now about, you know, examples they might have around this, where they may have seen good practice. I think it's, you know, accountability is something we always say like, yeah, we'll do it, but we don't pay as much attention to it as we possibly need to. So I'll open it up to our experts in the room before I ask either Vale or Gabby to jump in on that question. If I'm 100% looking at you, Catherine. And any other
Okay.
world vision? Yes.
Thank you. Hi, everyone, and thanks for the question. And I raised the question as well, because I do think what you just said at the beginning is very critical. Preparedness, shock responsive preparedness starts with having all systems really run effectively and efficiently. But I think we really often forget the user perspective, the end user perspective, which actually should be at the center of our thinking, right? So one of the things we've experienced with World Vision and the government of Bangladesh, for example, over the last couple of years, as you know, Bangladesh has a large-scale social safety net program, including cash transfers, but not only that. And World Vision, with local partners and other actors, actually worked on enhancing the awareness of information, who's entitled, eligibility criteria, and so forth, and the enrollment and the actual effective access to that. And over a couple of years, so this was just before COVID started, the increase of people being enrolled, the access of information increased to 83% from the baseline value of 15%. We just concluded last year an evaluation with the EU. And so the interesting thing is that people started to really appreciate and step up, even with their local government authorities, when they realized that someone was targeted that was not supposed to be on the list according to multiple criteria. And I do believe we have learned from that when we started to roll out multi-purpose cash programs for the COVID response, that it is very critical to enhance this engagement with local authorities. So it is not seen as a destructive and activist kind of approach, saying you're committing to a policy but you're not implementing it, but it is working alongside consistently and with the community, those that are supposed to be involved, to ensure they know and they have the ability. Digital literacy is one of the other aspects, to be able to understand how to access effectively. So just as an encouragement, this is one of the key areas to enhance shock responsive preparedness of all systems. And I think civil society has a key role to play in it. Thank you.
Thank you. And, you know, there is a question also around, you know, well, does anybody have anything to add to what Catherine has just presented and given us examples about, you know, the importance of this and how we can be looking at doing this? I see, Gabby, that you've put in some further examples from Nigeria, and that Save the Children was supporting social accountability mechanisms around social protection in 4 states, and that they're going to reorient some of these activities to support accountability. So that's great. Larissa has an example around in Sierra Leone, and Oxfam is setting up a social accountability mechanism for the health and education sectors so that people can engage in the design of the programs and that government systems can be better or more responsive, let's say, to people's needs. And so much of this is, you know, there are these different roles in terms of, you know, civil society is also supporting, and, you know, NGOs, INGOs, etc., can be part of that civil society who are supporting the government to meet their obligations around social protection, because it is not social protection is a right. You know, governments have that responsibility of everybody. Governments actually have that responsibility to make sure that people's rights are being met. Any other examples that people might have to be able to bring up around this, especially in terms of embedding any of these systems, etc.? There's also a question that Lisa Hannigan has put up in the Slido in terms of, you know, all the humanitarian cash transfers that we have been seeing, and how can these be embedded with the massive cash transfers, social cash transfers that we've been seeing governments doing and embedding things into a system, you know, in terms of preparedness and some essential actions. So maybe we look at it from that point of view instead. You know, how can we be using some of the good practice or some of the examples and, you know, the humanitarian side, learning and embedding some of social protection actions into their work. And then from the social protection side, you know, embedding or using some of the things that we are learning or seeing or have tools from the humanitarian side. What does that embedding process look like? Have we seen any of the things being embedded so far? If yes, how, where, what was there to enable that? And if not, how can we ensure that that happens so that we have stronger social protection systems? I'll take a breath and look for any unmuted mics.
I wanted to add one last point on the social accountability side and how, I mean, again, this is just one of those core areas where efforts before any crisis pay off in the future. And we've seen countries that had stronger systems of accountability where it's not just about focusing on that sort of the hotline as the one solution to the grievance mechanism that will solve everything, but actually having a broader system of accountability and embedding civil society kind of across every phase from design through to implementation. And countries where that was the case actually held their governments accountable to a stronger response, kind of social protection response to COVID. And kind of we can think of South Africa, even Brazil, actually kind of civil society has played a massive role in kind of making sure that people were being supported in the COVID response, and the expansion and even the expansion of duration of the current support. It was very much driven by civil society. And this kind of broader view is also about the leaving no one behind, and sort of something that the humanitarian sector has taken sometimes more seriously than social protection sectors. And Gabby has some great examples also from Turkey, where sort of the last mile was supported by the Turkish Red Crescent, while kind of core delivery was very much embedded in government systems. Over.
And this was for the COVID response, Gabby?
So that.
Oh, Vale?
No, yeah. No, Turkey was, I mean, this is in the ESSN kind of in the past, but again, all of these lessons are valid now as well. I don't know, Gabby, if you wanted to add anything there.
The only thing I would add, because you summarised it very well, is, you know, if we look at ESSN, I mean, that was at least phase one was a 2 or 2.5, I forget now, but it was a relatively long-term, you know, program, because it was designed for a protracted crisis. So you have that much more, I guess, sort of, you've got more time and you've got more resource to invest in these systems. And perhaps, you know, in some other types of crisis and response, especially maybe the early days of the COVID response, because no one knew exactly how long we were going to be in this position for. Maybe there has been less incentive to invest. But I think what we're seeing is, you know, increasingly, the important thing is to start investing in these things as part of the long-term social protection system, rather than as add-ons during shock. And I definitely think that civil society organisations have a role to play there. Like what Vale was saying, you know, hotlines are great and they have that mass reach, but they are not sufficient. That's what we're seeing in country after country, you know, and ultimately beneficiaries really value that face-to-face contact. And so if we're really being serious about putting, you know, accountability to affected populations first and foremost, then this is something we do need to start taking account of.
Thank you. And do we have other examples that people might have, or Vale, Gabby, to see, you know, what were actual, like actual concrete examples that governments were able to use either ideas or a system or a tool or something from the humanitarian side to scale up their COVID response? And, you know, it's leading into quite a few of the questions that we have already seen, but do we have, I know I can think of like 3 different examples, but yeah, Gabby, go ahead.
I'm just having a look down. Again, it depends. I can give you some examples from Nigeria where, let's say, things are still in almost like the planning stage because things got slightly delayed. But that's a good example of where there's this sort of cross-fertilization between government and its partners. So you've got the federal government planning this rapid response registration to support households affected by COVID in urban centres. And that this links to, but it's essentially in addition to the pre-existing social protection system, which was much more focused on sort of rural communities than the urban poor. Whereas COVID was obviously more of a sort of urban phenomenon in a lot of places. And partners are really trying to sort of align and harmonise and support that in different ways. So you've had some partners planning to assist the government to actually collect that data through contracting survey firms, because the state operational coordination units just won't have the capacity to run it at the scale that's needed. You've got other partners planning to embed technical assistance inside the government departments to ensure sort of consistent and quality data cleaning and utilisation of that data for targeting. You've also got partners that are planning their own responses that are funded separately by different sort of donations that they've raised themselves, and then there's the plan there, or at least an aspiration, to be able to ultimately try to build the underlying national social register. Whether that actually comes to fruition is another matter, but at least there are these aspirations of being able to join these two sides together, and then there's cross-fertilization in both ways.
Thank you. Those are some good examples coming out of Nigeria. Do we have any other country examples that we can be talking about where we have seen an embedding of something that was happening in a crisis situation before COVID, that then for COVID, governments, just pretty much took on and scaled up or embedded into their systems? I'm thinking about Jordan, and yesterday we had the Honorable Minister from Jordan giving a presentation. I would highly recommend that everybody go take a look at that. But it's something that UNICEF in Jordan, the Jordan Country Office, supported. We have this tool called Rapid Pro, and it is around registration, but it can also be like a delivery platform, etc. And the government of Jordan had to, for their National Aid Fund, which is their flagship umbrella sort of social assistance program, they had to do a very rapid scale up in order to get out social assistance to people. And I think it was something like 200,000 households that they very, very quickly registered. And it was through the Rapid Pro mechanism that they had been, partnering with UNICEF before, working on that, etc. And now it's something that they are, very much embedding into their system. They're looking at information management system as well. That is something that that UNICEF has been working. The UNICEF Jordan Country Office has been working with them before, in a situation of crisis. But for COVID, they have 100%, the impetus is there from the government side now to be able to improve their systems, to be able to take tools, adapt them to their own use as well now, in order to be able to roll out programs a lot better. Benjamin, I see there is a question from you, and if you can unmute yourself and just give us a little bit more, give us your question, but also be able to give us a little bit of a background around that.
Hi, no, it was just about the suggestion that face-to-face is important and, a good idea. I can see that, but in the COVID response, having kind of civil society actors going around beneficiary households doing face-to-face contact doesn't sound like a good idea. So, we've sort of said, let's go beyond hotlines. That's great. That sounds right. But it's kind of hard to see how you do some of the social accountability or kind of registration or safeguarding kind of whistleblowing stuff or other forms of sort of interactions with extremely vulnerable groups in the situation where there are lockdowns, there are restrictions on movement. Even if you are allowed, it's not very responsible to be sending people around house to house in remote areas. So that doesn't feel like a great kind of recommendation to me.
Okay, thank you for that. And you are working in Nepal, it looks like. Gabby, you are unmuted, go for it.
I mean, yeah, Benjamin's absolutely right. With the risk of transmission, it's something we need to take into account. But I think that what we're, or at least from my perspective when I'm giving these responses, I'm thinking beyond COVID. I'm not just thinking of, building shock responses, social protection systems that are going to be suitable for supporting a COVID-related response. I think we do need to be perhaps mindful that this COVID pandemic, it's like a 1 in 100-year event. I think countries are much more likely to be investing in shock responsive social protection systems for other types of shocks, and they're that in normal times, on a normal long-term social protection program, which is really the fundamentals that we need to be sort of building first and foremost. Face-to-face channels in normal times are something which are going to be important, but I absolutely take your point in the context that we're in right now. We do need to be making sure that we put into place, measures to safeguard staff and beneficiaries.
Thank you. Anybody got examples from other areas? Because I don't necessarily agree that you can't do face-to-face right now. But anybody else with any sort of examples to bring up on, go ahead.
I mean, sorry, so it's one that we've just picked up in the last few days, so I don't know the example well, but the Peru kind of Juntos program, which is their flagship social protection program in country, they've been liaising with local organizations, kind of informal worker organizations, older persons organizations, I mean, basically people working at lower levels of implementation, leveraging that capacity and collecting their, also, I mean, information on who their user base, who their membership people are, and using them for phone-based communications with both beneficiaries and non-beneficiaries. They're specifically looking at, they're adding kind of 2 add-ons to their core program on children kind of under 24 months, for example. And so again, it's about sort of flexible new ways of doing things, leveraging what's already there. And I mean, some countries, again, with systems that have been built up over time and relationships that have been built up over time are able to do that better. But I thought that was actually quite a good example from this perspective. And there's quite a few others where we're seeing sort of similar approaches of just leveraging those membership-based organizations down to local level for communicating and making sure that, for example, those grievances are being brought upwards.
Yep, and even in the height of COVID, I remember seeing a couple of examples, etc., because, registration was a problem. Governments were still governments and agencies were trying to figure out, right, how do we do online registration, but not everybody has access to that online registration, and what we can be looking at and what we can be doing. And I know in Nigeria, it was Action Contra la Femme, ACF had set it up. And, they made sure that they set it up in such a way that there was the physical distancing there. This was around payments and things like that. So they continued with their program. They just put measures in place. There was IOM, and this was in Latin America. And it was around Venezuelan refugees and helping them. I cannot remember now in which country. I have a feeling it might have been in Colombia, but I'm not entirely sure. I can look it up and, you know, put it inside the document that we have. But it was, again, for registration, because these are people who would not be part of the normal registration process or the normal payment process, etc. So again, setting up chairs and setting up things at a distance, etc. I also, you know, it's the Beirut blast that happened about a month ago, or actually a little bit longer than that now. The Lebanese Red Cross. And, you know, we're talking about civil society organizations and what Valentina has said, you know, and using those networks. And, you know, a national society, a local Red Cross and their network of volunteers is an incredibly powerful mechanism to be able to use. And to, I don't think we have anybody from the Red Cross. If we have got somebody from the Red Cross here, please unmute yourself or signal that you are here. But being able to use that network, I think can be, you know, huge, and it can give that face-to-face interaction, face-to-face at a 6 feet safe distance with your masks on, you know, and I think there's enough now messaging around this for people to understand, you know, you need to keep that distance, et cetera, et cetera. So I think there are ways and ways in which to be able to have a mix of, you know, distance and call centers and all of this sort of stuff and online mechanisms, but also bringing back that face-to-face interaction. Anybody else on this topic before we move on to coordination? Because we basically have 14 minutes left to go, and I see that is still a question that on the Slido is up towards the top in terms of how we can be coordinating better between the social protection and humanitarian sectors. Anybody else on? Nope. Okay, cool. So to kick us off on our last question that we're going to have, at least for this session, but as a reminder, there is a discussion document and a discussion forum, and we will be answering all of the questions that are coming in that. We also have a second session for this one, you know, Clinic 6B. So you are more than welcome to attend that as well. And yeah, we will look at the same sorts of questions, see what's happening with the Slido at that point and what people want to discuss and talk about. But definitely taking a lot of your ideas and questions from here to bring to that session. Coordination between social protection actors and humanitarian actors in country. Do we have good examples around this? And what are the common pitfalls that we are seeing? And Gabby, I'm going to ask you to start us off since you have had quite a bit of experience around this one.
Yes, and it's a challenge, I'm not going to lie. I'd say, you know, first of all, we need to think about the different levels of coordination that are needed, because everyone, I think, always jumps to sort of, oh, the humanitarian social protection divide or international actor government divide. But actually, I think that, you know, the one that's sometimes missing is the fact that there needs to be also coordination across government departments. You know, it's not just social protection ministries or social protection actors within government that have a responsibility to engage on this. It's going to also be, you know, departments that are responsible for perhaps civil registration, emergency response, disaster risk management, that sort of thing. And I'll start with the positives. I mean, the thing that I've seen work well in several countries, whether it's been introduced for a specific project, a specific response, whether it's been a bit more, you know, strategic, is having like a task force or some kind of forum. There isn't only one type of forum, but a forum that brings together those different actors, the different sides of government and the international partners. So we've seen that in Turkey. It worked very well in Turkey on the ESSN, Vale introduced before, and that also brought not only the actors responsible for the ESSN, but they also brought together the actors that were implementing the other shock responsive social protection program at that time, the conditional cash transfer education of refugees that UNICEF was implementing with the government of Turkey as well. Similar in Kyrgyzstan, similar right now in the COVID response in Armenia. There's a task force that's brought together these different departments of government with Red Cross, with UNICEF, with World Food Programme, and that is helping very much to coordinate the different levels of the social protection COVID response. I would say the main pitfall I've seen is competition. and the perception, at the very least, of the fact that this is going to create winners and losers. And I do think we need to be mindful of that as we move forward. And that can be within government, and it can be within international partners. You know, I think there's a perception that if a shock responsive social protection framework goes in a certain direction, that it's going to benefit certain actors and not others. Perhaps budgets are going to decrease, etc. You know, operational space is going to decrease, and unless we actually recognise this issue, then we're always going to have this sort of coordination blockage. And it is definitely donors. I've posted something in this chat further up, but donors in some contexts have really, I think, helped to kind of get across some of these sticking points and incentivise better collaboration and better coordination. And in some countries even going as far as funding dedicated coordination positions for a period of time. Yeah, I'll leave it there.
Cool, thank you. Anybody else around? Yeah, Vale.
I was actually wondering if Daniel Kumitz wanted to come in, because I mean, we engaged with Zambia to some extent in the kind of supporting in thinking through some of the decisions on the COVID response, and in general kind of we're very impressed by a one UN approach and kind of very close to government in its thinking. I don't know, Daniel, if you want to comment on that.
Sure, good morning again. Hi, Vale. But I couldn't. I've been thinking whether I should consider Zambia a positive or a negative example. But maybe a positive because we had our fair amount of challenges and came through with a strong approach. Because what happened at one point is that we ended up having two sectors in the emergency response, one for social protection, one for food security. Food security led with the humanitarian viewpoint, social protection obviously led with the more developmental viewpoint. And then both sectors identifying cash transfers as the best delivery approach for the emergency response, but coming from totally different starting point. So in social protection, the starting point is the normal social cash transfer, which is very low, with 90 kwacha at the moment, which is about $5 a month for a household, a family. And food security, of course, coming with the full food basket, which is around $20 a month. And then ILO came in with the basic needs basket, which was about $200 or $150 to $200 a month. And then you got a certain research envelope, and you know, the higher you go with the transfer amount, the less people you can cover. But the lower you go, the less impact you will have with the ones that you are covering. And then now, I think Vale made a comment earlier on how the leave no one behind principle comes more natural to the humanitarian sector. But it's a double-edged sword, isn't it? And we had this other comment on conflict. So if I now have a situation where the whole country is affected by poverty, and we have maybe half the country in chronic poverty that are hoping to get by the $5 of the normal social protection, and now I come with a humanitarian response to the emergency and go to maybe 5% of the population and give them and jump all the way from the $5 to the $20 that they need to have food security, but the rest of the country doesn't get anything. So how does that map out in terms of fairness and equity? So these are some of the very challenging questions. And now we had this fragmented into different pillars, isn't it? So we had the food security pillar doing their own discussion, their own analysis, their own assessment, their own field work, and the social protection working on it, and different donors. And the EU ended up funding both sides, with the delegation on the social protection side and ECHO on the food security side. But lo and behold, we lost time. So in the end, we came to our senses thanks to government. So I must give credit to the ministry. The ministry said, wait a moment, we can't have different NGOs. There were 4 NGOs also who are going by their footprint. They're not part of prioritization. They're not going to where the emergency is. They're just going where they have their footprint. But then they're also doing emergency cash transfer. And the ministry said, we can't have so many different cash transfers in the field at the same time, confusing the public. Constituted a cash working group, chaired on director level, but reporting back to the permanent secretary. And then I'd say we could have been in the field maybe 2 months quicker. But at least we went to the field with a harmonized approach, and we agreed on the I think the $40 food security, and we agreed on the $20. So the $20 was the compromise, and we're now covering 22 most affected districts, including a lot of urban areas and a lot of informal workers. So yeah, so
Brilliant.
maybe a good lesson learned. So maybe that's
Absolutely.
These are,
you should join the Failing Forward sessions. This is perfect material for that. There's another session in the conference called Failing Forwards, and it sounds like this
tomorrow.
process. Yeah. And if can I quickly add just something on that, because I feel like it's a story, it's a case study. You explained it incredibly well, and it's just exemplifying kind of how, I mean, every single one of those common objectives that in theory across sectors we're trying to achieve in terms of that, the coverage, the adequacy, the comprehensiveness, but also the timeliness and kind of the cost effectiveness across all those dimensions, and the intrinsic trade-offs that are there, and even the trade-offs of one sector taking over another, and then the role of government leadership in that. So it sort of exemplifies it all. And I mean, one thing that we've been working on with Space is just being aware of those trade-offs from the start. So not coming to it afterwards and realizing that kind of there might be an issue between two sectors, or kind of prioritizing different things. So in one case, one sector prioritizing transfer values, another one prioritizing coverage, for example, but coming together on those decisions to try and pursue common outcomes, acknowledging the trade-offs, but doing that together.
Yeah, and Benjamin, it's can you open up your mic? I realize we have very little time, but to just hear from a donor perspective as well, and FCDO, formerly DFID, they're big on funding the the coordination positions, as is ECHO. So I think it would be quite interesting to hear from your perspective, because we continuously keep saying that donors can influence this process and make us all coordinate a little bit better. So I think it would be quite interesting to be able to hear from you just for like a minute, if you are able to sort of talk about what is the main struggle, and as a donor, what do you need? What do you want people to be able to do? Yes, coordinate, but how?
Okay, yeah. So we funded an NGO position to work on the cash coordination group here in Nepal, and also provide quite a lot of funding to the RCO's office to kind of coordinate a one UN response in Nepal, both to COVID and to kind of recurrent shocks like flooding that happens pretty much every year. And yeah, it's been quite a difficult journey, and there seem to be some kind of structural issues about the way the humanitarian response works here, the way humanitarian response works in general, and the way that the UN works, that make it very difficult to coordinate, and seem to really mitigate against good coordination, and especially against a kind of sensible move towards shock responsive social protection, which does require so much coordination and sort of sharing. So we get proposals with like 10 small projects where there should be one, or there should be a collaboration. And yeah, it's incredibly frustrating, I must say. And I really worry about the future of the UN with these structural kind of factors that make it really difficult to have a kind of coherent and sensible response.
Thank you for that. I think some incredibly
Sorry, that sounds very
important.
negative.
No. I think it's pragmatic and realistic, and everybody needs to take a good hard look at themselves. And what Gabby said like 30, 40 minutes ago, what is the roadmap that the government has? Keep people at the center, and then everybody else's competition and things that I get very passionate about this. But I want to hand over to Tina, whose name maybe I'm not saying correctly, Irish Aid, working in Malawi, which is always held up as a good example, by the way, of collaboration and coordination. Tina, over to you, please. Can't hear you.
Okay, my comment really on this issue. I was raising my hand just don't know how to do it because I'm using the phone. I wanted to comment on the social accountability part, but since we've moved on, in terms of coordination, Malawi, I think it's an area where we are struggling. Just to bring the humanitarian actors as well as the normal social protection acts together. There seems to be coordination challenges at the lower level, at the district level, even at the national level, including even at the donor level. Coordination just is a big challenge. We just don't know how to fix that. We are trying as a DP group on donor, as a DP group on social protection, we have set ourselves a group that is trying to meet on a monthly basis due to the pandemic, but we have had challenges just to talk to the main counterparts, which is government. Government doesn't seem to be meeting regularly, even at the technical level. So those are the kind of challenges that we have, and we are now just trying to find a way like which would be our end points. So I'm happy to learn from the others, and it's something that I'm going to be taking forward, we move along. Thank you, over.
Brilliant, thank you. And given that it is 9 o'clock, we have used our hour. I want to thank everybody for that conversation. It took a little bit of pushing and prodding, but we got some mics open. Thank you very much for all of you who were able to come in. We will be having the second session of this, and it's already, I mean, everybody has already given us some incredibly useful ideas, etc., to be able to take forward. Come and join that as well if you have the time. I know it's asking a lot, but I think the coordination conversation is absolutely not over, and maybe we will take that one first. But a lot of good tools, hints, tips around the essential actions that we need to be able to take around preparedness of to have a more shock responsive social protection system. We talked quite a bit around social accountability and what that can look like. Are we looking at face-to-face? What are different bits and pieces that humanitarian actors can be taking from the social protection side, and vice versa, more importantly, vice versa. And also that coordination remains a massive and huge challenge, which it's that is clear. And I don't know if we are going to solve that problem, but I absolutely hope so, that we get there. A big thank you to Vale and Gabby to be here as our default sort of resident experts. We will be filling out that discussion Q&A document, so keep an eye on that one. And with that, thank you very much. Thank you very much to socialprotection.org and all the hard work that they have been doing in keeping us all here. And we'll see you at the other sessions, everybody.
And also on the discussion forum, join the discussion, because a lot of the questions will be, all of them will be answered on the discussion forum. So do join in. It is a forum. It's for anybody to be answering and adding and commenting.
And getting in there. Yep.
Yeah.
All right. Brilliant.
Thank you.
Thanks
Bye,
all.
everyone.
Take care.